Hi, I'm Alison from Newcastle Speech Pathology, and I'm chatting today with Andrew Wilkinson from See Hear Speak Psychology in Newcastle. And we've been having a conversation about some of our shared client group, which is those kids who are on the autism spectrum. So Andrew, I know that a lot of kids and families who experience children with autism finally do come through your door, but it's often not until they're at that point of crisis when behaviour is a real concern. So maybe can you talk us through what that might look like and perhaps the advantages of coming to see you a little bit earlier?
Yeah, absolutely. It happens quite common. We have many families going, my child's in meltdown, they're frequent anger episodes. What do I do? What do I do? So yeah, we often see families at that crisis point. And I guess when they come in, amongst other things, getting to know them, part of the big thing we're trying to understand, particularly with autism kids, and we know a bit more about this now, is there's meltdowns and then there's tantrums. And often we can get so easily confused about what is what. So I guess what we see is often a child who has a meltdown, and particularly with autism, we know they struggle with an overload often of when there's too much emotion around or too much sensory information, too much cognitive information. That can kind of overload their system. And often when that happens, it can look like they're just being a bad kid. They're having a tantrum, but in actual fact, they can actually be overloaded and be melting down. So the contrast of that, of course, is a tantrum. And I guess what we often see in a tantrum for most kids is it's really when they don't get something they want. They're frustrated, they can't get it, so they try to get it. So that's a good way to distinguish a meltdown and a tantrum. And the reaction to each of those is actually quite different. It's really quite different. So with a meltdown, a couple of the key things I want you to take away and remember is that it's really important for kids who are melting down with autism to have a bit of space, a bit of time, a bit of peace and quiet, and also to get some reassurance. And often that can help them come back down again. And often what we see is when it's a genuine meltdown, it actually takes not just a few seconds, but it takes minutes and sometimes up to an hour or two for them to really calm back down. On the other hand, with a tantrum, you can tell that because you know that because if they stopped it, it'd stop within a few seconds. They'd have that ability. And I guess what you want to see there is often that happens when kids are testing their parents. And by the way, kids with autism still have tantrums. It's not, they don't always have meltdowns, but they do have tantrums. But it's important for parents to be firm and non-negotiable when they set a limit, follow through on it, and that helps kids understand their parents are consistent and they mean what they say. So that's a couple of the differences there. So kids with autism do go both through tantrums and meltdowns, but they're much more likely to have meltdowns. And it's important parents pick up and understand when that's happening as opposed to having a tantrum.
Yeah. Fantastic.
And your question about getting in early, absolutely. Come and see us before you get to the meltdown phase, or if you're even getting little bits and pieces of that defiance and frustration, come and talk to us and we can help work through that.
That's great. Great to get there before the crisis hits. I know it's often hard to prioritise therapies when there's a lot on the plate, but certainly getting advice early and support early is great. So thanks for chatting. And if you would like to know more about how speech pathology and psychology can help your child and your family, then please get in touch and we can recommend a great practitioner in your area.